Hi everyone, this is Nigel here from Phoenix Rehab Physio Hand, and today I want to talk to you about knee ACL reconstruction. The key thing about ACL reconstruction is not just about choosing a good knee surgeon, a good knee ACL surgeon. That's very important. But the next level, the more important part after that is the first 12 weeks of physiotherapy for your post-knee ACL reconstruction rehab. That's really important, and I'm going to break it into 3 different phases so that you know what to expect and you know what to focus on. But first, some trivia, right? I'm going to show you something. I don't know whether you can see this. Can you see my knee over here? Right? So yes, I also had ACL recon done for myself. And what happened to me was that I was, a long time ago, when I was 13 years old, 31 years ago, I was playing in the playground, and I, like a silly boy, we were jumping from the second story of the playground to the first story, and everybody does this because we're playing catching. And it just so happened when I was from level 2 jumping to level 1, and there was sand at the bottom that was absorb the force, right? When I was just jumping down, some boy ran underneath me, and then my leg got hooked onto his shoulder, and he fell, and I fell alright on my knee, and I heard a pop, and that was the beginning of the terrible time for 13-year-old me. Of course, I didn't know better. My knee just grew swollen, right? And the saddest thing was when, so I was in Malaysia, and my father brought me to a doctor, and the specialist over there told me this: Nigel, there's nothing wrong with you. Here's some Panadol. Go home. And for me, I'm like, oh great, there's nothing wrong with me. Although my leg was really swollen, I couldn't walk for 1-2 weeks. And once the swelling settled down, what happened was that I realized that my knee could unlock each time I turned my body. It would just unlock and I'll collapse. And at 13-14 years old, I realized I had something wrong with my knee. And to cut the story short, I actually went for a surgery, an ACL reconstruction surgery with Dr. Chang in Changi last time when I was working there. And I went through a rigorous knee rehab with the CSMC, and they were really tough on me. But because they were so tough on me, my recovery became really well. I had almost twice daily physio. It was harsh, but it was great. So if you are thinking of knee surgery for your ACL, knee reconstruction surgery for ACL, you have to commit as well. If you want really good recovery, right, like back to sports, back to normal life, or even better than before, you have to commit 3 months or even 6 months. Really commit to knee physiotherapy. Okay, let's go to the 3 phases so that it's easy for you to understand. So phase 1 of post ACL recon, sometimes it's weeks 0 to 2, sometimes weeks 0 to 3. At this phase, you want to calm the swollen knee down, the post-surgery knee down, so that when you calm down, there's less swelling, there's less inflammation. We can actually start the knee physiotherapy, right? The most important thing is that you must understand that swelling isn't just, it just looks fat and swollen. No. A swollen knee will shut down muscles, especially your quad muscles, your thigh muscles. So if your thigh muscles is asleep, it cannot wake up, it cannot function. Everything below the thigh muscle, which is your knee, everything, it becomes also sleepy. It becomes harder. So we have to deal with this swelling at the early stage, and we have to make sure that you can push for as full extension as possible. Means that you have a straight knee. If you miss the straight knee early on, it will lead to limping problems and stubborn stiffness. That means your leg cannot extend fully, and this will slow everything downstream. So at this stage, we are dealing with swelling, we're dealing with knee extension, and we want to wake up your thigh muscles, your quad muscles. The common mistakes in phase 1 is that we are chasing exercises when the knee is still angry, is still swollen. We're not chasing exercises right now. You're not rushing to go back to sports. Right now, in phase 1, you're bringing down the swelling, bringing down the pain, straightening the knee as much as you can, and making sure that your quads, your thigh muscles can activate. We cannot ignore extension at this phase. Okay, all I've said is phase 1. Phase 2. Okay, let's talk about restoring the basics. This is weeks 2 to week 6. I like to stretch it a bit more, maybe week 2 to week 8, because I like the foundations to be strong. But standard is week 2 to week 6. The goal for this phase 2 of ACL Recon physiotherapy, right, is about walking normally and building your strength, layering your strength foundation. Okay, what matters most, the priorities of this phase is that we got to make sure your thigh muscles are strong AF, right? You got to wake them up, you got to strengthen it like mad. Our quads, our thigh muscle is our brakes and our shock absorber. If these muscles doesn't wake up, it's not triggered because it has been fallen asleep because of the swelling, your knee, my knee will feel very unstable, and our mechanics for the walking, standing, we will compensate. We start to walk with a bi-car, with a limping approach, and that will spoil things down the road. So you got to build on your quad strength, like a lot of quad strength. And at this phase also, you must agree and understand that progressive loading is more important than some random exercises that you find on YouTube or on Instagram. Control, gradual, progressive loading is king. No fancy moves, okay? A little bit more load, you can take a bit more, a little bit more control, you can take a bit more, a little bit more load. Week by week, we load up the strength and your control of your quad muscles. So what's good looks like in phase 2, where your walking is smooth, right? No limping, okay? There's no swelling after any rehab sessions. That will look good, and your strength is clearly adding up. You can load more, you can more control. The common mistakes in phase 2, where we talk about strengthening and quad control, the common mistake is when patients do too much too fast, then flares up the swelling, flares up the pain, then slow down therapy, slow down recovery. So we do not rush, no random exercises, it's gradual, it's loading. And we don't want to jump to advanced exercises because you want to rush or because you feel okay today. Steady by steady, step by step. So that's phase 2 of ACL physiotherapy for the knee post ACL Recon. Phase 3, right? This is where we are going to get you back to sport, back to life, back to normalcy, or back to above normalcy, right? So we want to rebuild your capacity to run, jump, cut, sport, pivot. At this stage of phase 3, what's most important, the highest priority of phase 3 is criteria based, it's not timeline based. I won't tell you, I mean, I'm not a knee physio. My knee physio won't tell you that, okay, by 12 weeks you will run, you will do this. No. We have to go step by step. If your knee recovery shows that you can go back to soccer within 12 weeks, yes. But if we look at the progress and say, hey, you know what? It might be you haven't hit the criteria, so let's put it down the lane. So it's criteria based to return to sports, not timeline based, okay? Your calendar doesn't tell you when you're ready. Your knee capacity, your knee strength, your knee control, your walking, your loading says everything. You earn running, jumping, pivoting by hitting milestones safely without flare-up, without pain. At this stage, phase 3, what you should be thinking about is all about how you can progressively safely load more strength, more power, more control, more stamina. Not just that, can I do it? No, we are going to do it, but stages. And we want to have symmetry, we don't want to have compensation, we don't want to have one side stronger than the other, and we don't want to have pain flare-ups after trainings. Okay? The most common mistakes in phase 3 is that we rush through to go back to sport. We rush through because you want to get it done, because the timeline is there, because the pain is low. No. Please don't rush. If your body shows, your session shows that you are ready criteria wise, we will push you to go and do it. If not, we have to hold you back, because safe recovery is more important than uncertain re-injury, right? Okay, so what to look out for, what are the biggest red flags in ACL knee physiotherapy, right? Okay, you have to call your orthopedic surgeon, call me, call the physiotherapist, right? If you have fever, if you heard a pop again, if you felt a lot of heat, redness, swelling around the knee, or you felt your knee giving way, like last time I explained to you, the knee giving way again, or a swelling that keep getting worse and doesn't go down. These are the 5 examples of red flags that you need to flag up to us quickly or to your knee surgeon immediately. What to look out for. So to end of this video, what I'm going to say is this: if you are planning to do a knee ACL surgery, reconstruction surgery, okay, or you have already done it, schedule an appointment with us, schedule a session, commit a time of knee recovery. We will tell you what phase you're at, what milestones you hit this month. We will handhold you to go through phase 1, phase 2, phase 3, carefully, successfully, step by step, so that you don't keep re-injuring yourself, so that the pain don't flare up, or so you don't miss certain things. Most importantly, all these conversations, all these thoughts should happen before you have the surgery, so that we can plan it out for you, so that your physiotherapy sessions with us are already planned out, right? It's easier rather than last minute. We will find a way to serve you anyway. But just have a think about that. If you're going to do knee ACL recon or you already had it, quickly call us. Don't wait. Okay, don't wait until the pain goes down. I started my knee ACL physiotherapy on day 1. Actually, no, yeah, day 1 after the surgery, and because of that, my recovery is much better. So good, you know. So drop me a text, drop me a call, or just write in and then let me know how we can serve you. Take care. See you next video. Bye.